So what procedures do you give a bone graft, and how do you do it? What's involved?
It varies case to case, Randy, honestly. Sometimes if we're removing a tooth, the majority of time that I remove a tooth and the patient wants a tooth to go back in there, I'm putting an implant in the same day, the majority of the time.
Okay.
I don't graft the ridge, wait for it to grow, and then come back and hope that the bone's good and place an implant. That bone is in a perfect condition to heal and to grow the day that that tooth's removed. So we'll place the implant at the same time. We will graft in that area, and then we just cover it up.
Is
Now,
it bone building material you're putting in there?
It is human bone, which
Okay.
some people kind of freak out about, but it's important to understand that there has never been a case of disease transmission from human bone that is harvested like this. We buy it through controlled sources. It goes through a very extensive cleaning process. There are other options available. There's bovine bone. There's synthetic bone. They just don't work as well. When your body recognizes the graft that's in there, and the body says, you know what, this is human. I like this. I can grow into this. It grows so much better. And we can, the things that we're doing now that we couldn't do 10 years ago with bone grafting is really kind of exciting, because a perfect example, when we had people say, well, my dentist told me 10 years ago I didn't have enough bone to put implants in. I rarely see someone that's truly the case. Okay. Because we have the ability to be able to grow bone. If we need to, we can grow bone.
Does it hurt? Does a bone graft hurt?
The bone graft doesn't hurt any more than having a tooth removed. A lot of times, a lot less, because when you have a tooth removed, you have a situation where you can get an infection. It's not the removal of the tooth that hurts. A lot of times, it's the infection. Okay. So when bone grafts are done properly and with the proper care, they are very predictable. Especially one of the big issues that we see on someone will lose their top teeth on the maxilla, in the posterior part of their top. And there's big sinuses, there's big air spaces over that. And as soon as you lose those back teeth, those air spaces are expanding. And they'll come in 3 or 4 years later and the tooth hasn't been gone that long, but there's no longer bone up there. Sometimes it's paper thin. It's one of the most predictable places for us to grow bone in that sinus.
And then to be able to put a tooth in there after that.
It's amazing. If we have most of what we're doing now that we weren't doing 10, 12 years ago, the same day that I put the bone in the sinus, most of the time I put an implant in as well and let it just all grow and heal together.
Right there.
Speeds us up. It speeds us up by 3 or 4 months sometimes 5 months doing that. So that's what you get.
So if you hear you need a bone graft, it's not something to worry about.
Oh no, it's routine.
It's routine for you.
It's routine. It's what we do. We do it on every case, every denture case, every fixed case, every case where these people that are coming in, every single one of those cases that I showed you earlier, they all have bone grafts. Most of them don't even know it. You don't know it. I mean, it's just part of what we do.